this is Jenny Peaceful Yapnyao, a student from Christo Jayanti College, Autonomous Bengaluru, and I am currently pursuing Master in Social Work. So friends, today I want to talk the crucial aspects of our profession, that is the importance of empathy in social work. Coming to the introduction part, that is empathy is the ability to deeply understand and share another person's emotions. It goes beyond just acknowledging what someone is going through. Empathy is a key part of a successful relationship and can help people understand other perspectives, their needs, and the intentions of others. So it can also help people build compassion and the livelihood of helping others. So most of the time, empathy and sympathy are always confused. Sympathy, which is feeling sorry for someone, whereas empathy is more about understanding another person's experience. Sympathy is more about being moved by or responding to another person. Sympathy is the feeling pity or sorrow for someone, whereas empathy is in other hand, involves putting ourselves in another person's shoes to understand more about their emotional problems and the issues that they are facing it. Example, sympathy say, I'm sorry you are struggling a lot, while as empathy say, I understand this is really tough for you. So the next content is about empathy as a core skill in social work. In this content, I'll be highlighting 4 points, that is enhance communication, build trust, then understanding client perspective, and cultural competence. The first one is enhance communication. Empathy helps clients feel understand, make them more open up, or make them more comfortable, and willingness to share their personal details. This is a vital for accurate assessment. The second one is build trust. A client needs to trust their social worker before they can engage deeply in the process. Empathy fosters a safe, then non-judgmental space where clients feel very valued. The third point is cultural competence. In diverse setting, empathy allows social workers to acknowledge and to understand cultural difference without judgment, then leading them to be more effective and respectful intervention. The last point is understanding client perspective. Every client situation is very unique. Through empathy, social workers can better understand the client's feeling, then their cultural background and their life experiences. This understanding leads to be more in the effective intervention because it allowed the social workers to address the root causes of the clients from the surface level issues. The next content is empathy in different social work settings. The first setting is medical social work. Empathy is essential when working with patients and family dealing with illness. It helps the social workers to support their clients or the family emotionally while they navigate complex health challenges like dealing with a diagnosis or an of-life decision. The second one is psychiatric social work. In mental health setting, empathy is a key component in forming a therapeutic alliance. Clients need to feel understood, especially when discussing difficult emotional challenges or psychological experiences. The third one is child welfare. Empathy helps when working with the children in foster of the family in crisis. Understanding the fear, the anxiety, or any uncertainty allows social workers to provide a compassionate care and advocacy that they are needed. The last one is working with marginalized community. Empathy is particularly important when working with a population for systematic issues such as homelessness, then poverty, and any racial discrimination. Social workers must understand their emotional and social complexities the client face, advocating for the needs and provide support in a way that is compassionate and respectful of their life experiences. The next content is how this empathy can be practiced in social work. So in this, I'll be highlighting 4 points. The first point is active listening. In active listening, we give full of our attention to the clients, reflects their emotional bags to them to show that we are already understanding the issues faced by the client and encourage them to open up more with the social workers. The second one is mindfulness. Regular self-reflection helps social workers to be aware of their own emotional reactions and bias. This allowed the social workers to approach each client with fresh eyes and with any assumption or with a free assumption. The third point is continuous learning. Empathy grows with a continually learn about the different cultures, social system, and challenges that the people face. The more the social worker know, the better the social worker can understand and relate the clients with different background. The last one is reflect responding. This technique involves the paraphrasing and summarizing what the client says to ensure that their words are already heard by the social workers. For example, if a client says, "I am feeling overwhelmed by everything happening," so as a social worker, I will respond that it sounds like you are feeling pressure and you don't know where to start. This reassures that the client feelings are already heard or validated by the counselors or by the social workers. To the next content, that is balancing empathy with boundaries. The first one is avoid over-identification. While it's important to connect emotionally with the clients, there is a danger of over-identification with the struggles. If a social workers become too much emotionally involved, it could cloud their judgment and make it difficult to provide objective or professional support. The second one is setting boundaries. Empathy does not mean that taking all the client's emotional burdens. Social workers need to maintain professional boundaries to stay effective and focus on helping clients in a sustainable way. The third one is self-care for social workers. Compassion fatigue is a common challenge that the social worker face, where too much emotional investment can lead to burnout. Social worker must prioritize self-care, whether through regular breaks, then peer support, or mindfulness practices to maintain their emotional health and continue providing empathic care to the clients. Next, let's proceed to the challenges of empathy in social work. The first one is emotional burnout. Constantly empathizing with the clients, especially those in distress, can lead to the compassion fatigue or burnout. Social workers need to practice self-care to maintain their well-being. The second one is maintain professional boundaries. It is easy to become emotionally involved, especially when empathizing deeply. Social workers must balance the emotional engagement with professional detachment to avoid clouded judgment. The last one is dealing with resistance. Some clients, especially those who have their trauma, may resist empathy because they have been hurt before. This requires patience and consistent efforts from the social worker to build trust over a time with the client. So next, let's discuss about the long-term impacts of empathy in social work. The first one is building trust and rapport. Empathy helps create a foundation of trust between social workers and the client. Over time, this trust enables clients to open up more freely with the social workers, discuss deeper issues, and engage in actively in intervention. The strong the relationship, the more effective the support and the long-term progress. The second one is improve the client outcomes. When clients feel understood and supported, they are more likely to adhere the treatment plans to attend the session and apply the coping strategies. Over the long term, this results in better the mental health issues, then stronger the family relationship, and improved social functioning, especially in the areas like addiction recovery or trauma healing. The third one is fostering long-term client engagement. Empathy encourages client to stay engaged with the service. While clients feel heard or validated, they are more able to have that motivated and to continue working with the social workers, which increase of achievement of sustainable positive change over a time. The fourth one is enhance professional skills for social workers. Regular practice of empathy strengthen the social worker skills in the communication, then cultural sensitivity and emotional intelligence. These skills over a time make the social worker more adept handling the complex cases and understand the diverse client perspective, leading to the more inclusive of an effective service. The fifth one is increase cultural competence. Empathy encourage social workers to understand the client with their cultural context. Over a time, this improves the ability to work with diverse population, making social workers practice more respectful and responsive to different cultural needs, contributing to more equitable outcomes. The second last one is risk of emotional burnout. A potential long-term impact the empathy in emotional burnout. Constantly empathizing with the client, especially in the high-stress environment, can lead to compassion fatigue. Social workers must practice self-care and set emotional boundaries to prevent burnout and maintain their effective offer. The last one is advocacy and social change. Empathy also drives social workers to fight for systematic change. By understanding the personal struggles of the client, social workers can advocate to the policies and the programs that address the broader societal issues like inequality, discrimination, or any kind of poverty. So, in conclusion, I can say that empathy is essential in social worker because it's build trust, then it's enhance the communication skill, and create meaningful connections that leads to better outcome for the clients. It is the foundation of an effective social work practice. Empathy is not just a empathy is not just a professional skills, but it is also a fundamental value. It's also help the social worker to build a strong relationship with the clients, create positive change, and advocate for more just of a compassionate society. As we complete our discussion on the importance of empathy in social work, I want to leave you with a challenge. Empathy is the bridge that connects us all, and it is our responsibility to build stronger bridge, one compassion interaction at a time. Let's harness the power of empathy to transform life and create a more caring to the world. Remember that empathy is not just a skill, but it is also a superpower that can change the world. As we reflect on the significance of empathy in social work, let's ask this question to ourselves. How can I show up with more empathy today? Empathy is a journey, it is not a destination. Let's continue to learn, grow, and deeper understanding of others. May our empathy inspire hope, healing, and positive change in the life of those who serve. Thank you.